everyone. I hope we find you all well today. My name is Amanda, and this is Nicole. We're here to discuss the topic of stroke. Some of you might have had a stroke before, or know someone who has. Strokes can be life-altering and scary, but with proper information, they can be overcome or prevented. We will be covering important information, including causes, preventions, identifying strokes, and caring for someone post-stroke. You might be wondering, what is a stroke? Strokes occur because blood stops flowing to your brain, and so your brain cannot get oxygen or nutrients. Brain cells die very fast, so emergency treatment is important during a stroke. These days, much less people die from stroke than they used to. So how can you tell if someone is having a stroke? We'll spot the sudden signs. First, you might notice slurring speech. If you are having stuttering problems, this could be a sign of stroke. You might even have difficulty understanding others. Also, walking might become difficult. If you are feeling dizzy, stumbling, or cannot walk in a straight line, this could indicate stroke. Numbness of the face, or legs, or arms, usually on one side only, is another symptom. If you feel weakness, numbness, or full paralysis, try lifting both arms and seeing if either one droops, or if you cannot lift one fully. Next, try to smile. If one side of your mouth droops, you might be having a stroke. If you are struggling to see in one or both eyes, this can be another indicator. Sudden blurriness or blacking out is cause for concern when experienced with these other symptoms. A sudden headache or migraine will likely come during a stroke. It could be painful enough to cause nausea and vomiting. If you experience these symptoms or see them in someone else, call 911 immediately or get the victim to the nearest hospital. Don't wait. It might be tempting to see if symptoms fade, but the faster you react to them, the better off you'll be. Remember, fast, facial drooping, arm weakness, slurred speech, time to call 911. Stroke symptoms can come and go during a stroke. And remember, brain cells die during the attack. So get to a medical professional fast. If you are with someone who is having a stroke, stay with them and watch them carefully until help has arrived.
What can happen when you have a stroke? Many complications can arise from having a stroke. It can cause permanent disabilities, which is why fast response is crucial. Paralysis of a limb or an entire side of the body can result from a stroke. You can also lose control of certain muscles in your body. You might experience long-term difficulty speaking or swallowing. The muscles of your mouth and throat are usually the highest risk for being affected by a stroke. Impeded speech and understanding language can also result from the consequential brain damage. Memory loss, including difficulty creating new memories and forgetting old ones, can result from a long stroke. Emotions can also be affected by a stroke. Anger and depression are common after a stroke as well. This doesn't always last forever, but it can be difficult if someone hasn't experienced problems with emotional management before. Of course, pain from a stroke is very common. Parts of the body might experience tingling or have sharp shooting sensations now and then. If you lose feeling in a limb and then recover it later, this can cause pain as well. Those who have had a stroke will likely need help with self-care. So understanding, compassion, and assistance with basic needs is important. We'll talk more about that later.
After all of this information, you may be wondering, what can be done? Let's talk about risk factors. Modifiable risk factors are those you can improve by changing your lifestyle. Being overweight, physically inactive, using drugs, or binge drinking are all factors that can contribute to stroke. Smoking cigarettes and even secondhand smoke can increase your risk. We will discuss how to modify these later. Non-modifiable risk factors are those you cannot improve, but they're important to remember for your healthcare provider. High blood pressure, cholesterol, diabetes, sleep apnea, and heart problems can all increase your risk of having a stroke. If you have a family history of stroke, you should let your doctor know. What we're just now learning too is that COVID-19 can increase the risks of having a stroke. People who have an increased risk for stroke are African Americans, people age 55 and older, men, or people on estrogen. Now let's get back to those modifiable risk factors. How can we change our lifestyle to prevent stroke? Very common preventative measures include quitting smoking, drinking less, and eating better. What can we eat? Well, on our nutrition board we have, instead of ice cream, eat yogurt. They both taste pretty good. Instead of donuts, eat fruit. There's a lot of sugar in fruit. Instead of steak, eat fish. Steak can increase your bad cholesterol, whereas fish can decrease your bad cholesterol. Instead of potato chips, eat popcorn. Popcorn is a very healthy snack when it's not covered in butter and salt. Instead of soda, drink water. It's important to stay hydrated. Less cholesterol and fat in your diet will reduce buildup in your arteries. Eating fruits and vegetables, 5 servings per day, is a great way to improve your diet. Exercise and losing weight can also help prevent a stroke. Getting your blood pumping on a daily basis helps all sort of cardiovascular problems. Exercise can lower your blood pressure. Gradually work your way up to at least 30 minutes of exercise per day. Don't push too hard and you will start to feel better on a daily basis. Managing other healthcare problems is a surefire way to decrease your risk of developing more problems, like stroke. Keep your blood sugar at a healthy range. Control high blood pressure. Treat sleep apnea problems. Talk to your doctor about maintaining your health and follow up regularly. Make sure you are taking your medications properly and not mixing them with alcohol and drugs.
Another piece of important information you might need to know is types of stroke that you could be having. What kind of stroke are there? Types of stroke are there? There are 2 types. One is an ischemic stroke, or clot. An ischemic stroke, while treating Another piece of information you might like to have is the types of strokes. What kind of stroke are you having? There are 2 types of strokes, ischemic and hemorrhagic. See, while treating stroke, it is important to know which type it is. The first type is an ischemic stroke. According to the American Heart Association, an ischemic stroke occurs when a blood vessel in the brain is obstructed, like a clot. It accounts for about 87% of strokes. This type of stroke needs blood thinners to break up the clot to return blood flow through the brain. Antiplatelets and anticoagulant drugs can be used to help prevent these types of strokes. And they are usually given to someone who has already had a stroke to help prevent a second stroke. Now the second type is a hemorrhagic stroke. This type, according to the American Heart Association, this type of stroke is caused by bleeding in the brain. Therapeutic medications focus on reducing blood pressure. You might be familiar with these types of medications like Lopressor. Now speak with your healthcare provider about any medication you are taking and follow their directions. Remaining on medication schedule is important in the preventative phase.
Now let's say you know one who's had a stroke. How would you care for them? What can you do to help them recover? Recovery will happen over time. The fastest recovery usually happens in the first 3 to 4 months after a stroke, but some survivors could continue to recover well into the first and second year. Be sure to ask your doctor or nurse about the victim's medications. Know the side effects and what to watch out for. Make a list of medications and organize them to make sure the victim takes what is necessary at the right time.
Sometimes a victim's home might need to be modified to help prevent falls and ease of movement between rooms and to use the bathroom. Be prepared to do this before the victim comes home. The doctor or the nurse can give you more information about how to do this and how to go about modifying your home.
Remember those modifiable risk factors? They'll show up again after a stroke. Survivors of a stroke are at high risk of having another stroke. Make sure the victim eats a healthy diet, exercises, takes medications as prescribed, and visits their healthcare provider regularly.
And physical therapy can help for survivors after a stroke as well. You should consider getting help from a physical or an occupational therapist if the victim has dizziness, frequent falls, or difficulty walking and moving around, including needing to rest after a small amount of movement. Falls are common after a stroke. Be sure to check for injury after a fall, like bruising and bleeding, and contact a healthcare provider if these things happen.
Changes in emotions and attitude are also common after a stroke. Depression can affect 30 to 50% of survivors. Encourage communication with the victim and consult your healthcare provider if emotions become too much for them. Support groups can also help managing depression or anxiety after a stroke. There are even support groups that focus on caregivers and victims post-stroke. Finally, don't forget to take care of yourself as well. Take a break from caregiving by asking a family member, friend, or neighbor to help while you take time for yourself. Eat healthy, exercise, and get adequate rest. You can't help someone if you are not cared for. Remember, on planes, we put our masks on before we assist someone else.
We hope that this presentation has helped you to inform you about all of the aspects of stroke, and that now you know how to handle having a stroke or for caring for someone who has had a stroke, and all the post-stroke care. Don't be afraid to ask your healthcare providers about a stroke. They will be glad to answer questions and to help you prevent a stroke. Have a great day, and thank you for your time.